Now, today we're tackling something that's been whispered about in doctors' offices, searched privately on the internet, and wondered about by countless men who've crossed the 50-year threshold. The relationship between daily masturbation and prostate health. Is it good for you? Could it be harmful? Does frequency matter? And what does the actual science say versus what we've been told by outdated myths and cultural taboos? If you've reached your 50s or beyond, you've probably started thinking about your prostate more than you ever did in your younger years. Maybe you've experienced some urinary changes, or perhaps you know someone who's dealt with prostate issues. You might be asking yourself whether your sexual habits are helping or hurting your long-term health. Here's the exciting part. Science has actually studied this question extensively, and the answers might completely change how you think about your sexual health. So let's cut through the myths, examine the real facts, and give you the evidence-based information you need to make informed decisions about your sexual wellness. And remember, there's absolutely nothing to be ashamed of here. We're talking about normal human physiology and how to optimize your health as you age. When we talk about prostate health benefits related to ejaculation frequency, we're discussing something that has captured the attention of medical researchers for decades. The connection between regular sexual activity and prostate wellness is more significant than many men realize, and the science behind it offers compelling reasons to maintain an active sexual life well into your senior years. The prostate gland, though small in size, plays an enormous role in male sexual and urinary health. This walnut-sized organ sits just below the bladder and surrounds the urethra, producing the fluid that makes up a significant portion of semen. As men age, particularly after reaching their 50s, the prostate undergoes natural changes that can impact overall health and quality of life. Understanding how regular ejaculation influences this vital gland becomes increasingly important as we navigate the aging process. One of the most remarkable findings in recent medical research centers on the relationship between ejaculation frequency and prostate cancer risk. Large-scale studies, particularly the groundbreaking research conducted by Harvard Medical School, have revealed fascinating connections. This extensive study followed nearly 32,000 men over an 18-year period, tracking their ejaculation frequency and subsequent health outcomes. The results were striking and have reshaped how medical professionals think about preventive prostate health. Men who ejaculated 21 or more times per month showed approximately a 20% lower risk of developing prostate cancer compared to those who ejaculated only 4 to 7 times monthly. This protective effect appeared consistent across different age groups and was particularly pronounced for lower-grade prostate cancers. But why does this happen? Scientists have proposed several compelling mechanisms that explain the protective benefits. The most widely accepted theory is what researchers call the flushing hypothesis. Think of your prostate as a dynamic organ that constantly produces secretions and accumulates cellular material. Regular ejaculation acts like a cleansing mechanism, helping to flush out potentially harmful substances, old cellular debris, and stagnant secretions that might otherwise accumulate in the prostate tissue. When these materials remain in the prostate for extended periods, they may contribute to inflammation or cellular changes that could potentially lead to cancer development. By ejaculating regularly, you're essentially helping your body maintain a cleaner, healthier prostate environment. Beyond the flushing effect, regular ejaculation may also reduce chronic inflammation within the prostate gland. Chronic inflammation has been identified as a significant risk factor in the development of various cancers, including prostate cancer. When the prostate experiences repeated inflammatory episodes without adequate clearing mechanisms, it creates an environment where cellular mutations and abnormal growth patterns can develop more easily. Regular sexual activity and ejaculation appear to interrupt this inflammatory cycle, promoting a healthier cellular environment within the prostate tissue. The hormonal aspects of regular ejaculation also play a crucial role in prostate health. Sexual arousal and orgasm trigger a complex cascade of hormonal responses throughout the body. These hormonal fluctuations help maintain the delicate balance necessary for optimal prostate function. Regular sexual activity helps keep hormone levels stable and prevents the stagnation that can occur when men become sexually inactive for extended periods. This hormonal equilibrium supports not just prostate health, but overall male wellness, affecting everything from mood and energy levels to muscle mass and bone density. Another important consideration is how ejaculation affects the cellular turnover rate within prostate tissue. Like all organs, the prostate constantly regenerates, with old cells dying off and new cells forming. Regular ejaculation may promote a healthier rate of cellular turnover, preventing the accumulation of damaged or abnormal cells that could potentially become problematic. This dynamic process of renewal and regeneration becomes even more critical as men age and natural cellular repair mechanisms begin to slow down. The prostate also produces specific proteins and enzymes that play roles in semen composition and male reproductive health. Regular ejaculation ensures that these substances are produced, utilized, and replenished in healthy cycles rather than becoming stagnant. This active production and release cycle may help maintain the prostate's metabolic health and functional capacity over time. When the prostate remains actively engaged in its primary functions, it tends to maintain better overall health compared to when it becomes relatively inactive. Research has also shown that men who maintain regular sexual activity throughout their lives tend to have better overall prostate health markers as they age. This includes not just cancer risk, but also lower rates of benign prostatic hyperplasia symptoms and better urinary function. The prostate doesn't exist in isolation from the rest of the male reproductive system. Regular ejaculation maintains healthy function throughout the entire system, from the testicles through the vas deferens and into the prostate itself, creating a comprehensive approach to male sexual health maintenance. The connection between regular sexual activity and hormonal balance represents one of the most profound yet often overlooked aspects of men's health after 50. When we discuss hormonal and physical wellness in the context of ejaculation frequency, we're exploring a complex interplay of biochemistry, physiology, and overall vitality that extends far beyond simple sexual function. This intricate relationship affects virtually every system in the male body, from cardiovascular health to mental acuity, from muscle mass to bone density, and from energy levels to emotional stability. Testosterone stands at the center of male hormonal health, often called the master hormone for men because of its wide-ranging effects throughout the body. As men age, testosterone levels naturally decline, typically beginning around age 30 and continuing throughout life. This gradual decrease, sometimes called andropause or male menopause, can lead to numerous unwanted changes, including reduced muscle mass, increased body fat, decreased energy, mood changes, and diminished sexual desire and function. However, what many men don't realize is that maintaining regular sexual activity, including masturbation, plays a crucial role in supporting healthy testosterone production and utilization throughout the aging process. The relationship between sexual activity and testosterone is bidirectional and fascinating. While testosterone drives sexual desire and function, engaging in sexual activity also influences testosterone levels in return. Regular sexual arousal and orgasm signal to the body that sexual function remains important and necessary, encouraging the continued production of testosterone and other sex hormones. This creates a positive feedback loop where sexual activity supports hormone production, which in turn supports continued sexual interest and capability. Men who maintain regular sexual activity tend to preserve healthier testosterone levels compared to those who become sexually inactive, even when controlling for other health factors. Beyond testosterone, sexual arousal and orgasm trigger the release of numerous other beneficial hormones and neurochemicals. During sexual activity, the body releases dopamine, often called the pleasure hormone, which not only enhances sexual enjoyment, but also supports motivation, focus, and overall mood. The hypothalamus releases oxytocin during orgasm, sometimes called the bonding hormone, which promotes feelings of connection, reduces stress, and contributes to overall emotional well-being. Additionally, endorphins flood the system during sexual climax, providing natural pain relief and creating feelings of euphoria and relaxation that can last for hours after the activity concludes. The physical wellness benefits of regular sexual activity extend throughout the cardiovascular system. Achieving and maintaining an erection requires a sophisticated orchestration of blood flow, nerve signals, and vascular health. The penis contains specialized tissue called corpus cavernosum, which must fill with blood to create an erection. This process demands healthy blood vessels, strong blood pressure regulation, and efficient circulatory function. Regular erections, whether from sexual activity or masturbation, serve as exercise for this vascular system. The increased blood flow oxygenates penile tissue, maintains the elasticity of blood vessels, and preserves the smooth muscle tissue necessary for erectile function. Men who maintain regular sexual activity literally keep their erectile machinery in better working order compared to those who allow long periods of sexual inactivity. The concept of use it or lose it applies remarkably well to erectile function. When men go extended periods without erections, the penile tissue can experience what researchers call tissue hypoxia, a lack of adequate oxygen supply. Over time, this can lead to subtle changes in the tissue structure, potentially including some degree of fibrosis or scarring within the corpus cavernosum. These changes can make future erections more difficult to achieve or maintain. Conversely, regular erections provide the oxygen-rich blood flow necessary to keep penile tissue healthy, flexible, and responsive. This principle becomes increasingly important as men age, and natural erectile function faces more challenges from various age-related changes. Pelvic floor muscles, though rarely discussed in men's health conversations, play an absolutely critical role in sexual function, urinary control, and overall pelvic health. These muscles form a supportive sling at the base of the pelvis, supporting the bladder, bowel, and sexual organs. During sexual arousal and orgasm, these muscles contract rhythmically, contributing to sexual pleasure and helping to expel semen during ejaculation. Regular sexual activity serves as natural exercise for these muscles, maintaining their tone, strength, and coordination. Stronger pelvic floor muscles contribute to better erectile rigidity, enhanced orgasmic intensity, improved ejaculatory control, and superior urinary control. Many men over 50 experience some degree of urinary urgency or occasional leakage, conditions that stronger pelvic floor muscles can help prevent or minimize. The neurological aspects of sexual function also benefit significantly from regular activity. Sexual arousal and response involve incredibly complex neural pathways connecting the brain, spinal cord, and genital region. These pathways require regular stimulation to maintain optimal function. Just as the brain maintains better cognitive function through regular mental exercise, the neural pathways involved in sexual response remain more responsive and efficient when regularly engaged. This neurological maintenance helps preserve sexual sensitivity, arousal capacity, and orgasmic function throughout the aging process, allowing men to continue enjoying satisfying sexual experiences well into their later years. The psychological and emotional dimensions of sexual health represent perhaps the most underappreciated yet profoundly important aspects of male wellness after 50. While medical discussions often focus exclusively on physical health markers and disease prevention, the mental and emotional benefits of maintaining regular sexual activity deserve equal attention and recognition. These psychological benefits ripple outward, affecting not just sexual satisfaction but overall quality of life, relationship dynamics, mental resilience, and the fundamental sense of vitality and purpose that defines successful aging. Stress represents one of the most pervasive health challenges facing modern men, particularly those navigating the complex demands of careers, family responsibilities, financial pressures, and the natural anxieties that accompany aging. Chronic stress doesn't just feel unpleasant, it actively damages physical health by elevating cortisol levels, increasing inflammation, raising blood pressure, and compromising immune function. The stress response, designed for short-term survival situations, becomes pathological when activated continuously over months and years. Sexual activity and orgasm provide one of nature's most effective stress relief mechanisms, offering a natural counterbalance to the chronic stress that characterizes contemporary life. During sexual arousal and climax, the brain releases a powerful cocktail of neurochemicals that actively combat stress and promote relaxation. Endorphins, the body's natural opioids, flood the system during orgasm, creating feelings of pleasure and well-being while simultaneously reducing pain perception and anxiety. These endorphins interact with receptors in the brain that are similar to those affected by morphine and other opioid medications, but without the dangerous side effects or addiction potential. The natural high that follows orgasm can last for hours, providing sustained relief from stress and tension that accumulates throughout daily life. Oxytocin, often called the love hormone or bonding hormone, surges during sexual activity and peaks at orgasm. This remarkable neurochemical does far more than facilitate emotional bonding between partners. Oxytocin actively reduces cortisol levels, the primary stress hormone, creating a biochemical shift away from the fight or flight response and toward rest and recovery. Research has demonstrated that oxytocin reduces activity in the amygdala, the brain's fear and anxiety center, while simultaneously increasing activity in brain regions associated with reward, pleasure, and social connection. For men experiencing the stresses of aging, career pressures, or life transitions, this regular oxytocin boost provides invaluable psychological protection. Sleep quality often deteriorates as men age, with many experiencing difficulty falling asleep, frequent nighttime awakenings, or early morning waking. Poor sleep creates a vicious cycle, contributing to daytime fatigue, mood problems, cognitive difficulties, and increased stress sensitivity. Sexual activity, particularly orgasm, promotes better sleep through multiple mechanisms. The hormone prolactin, released after orgasm, induces feelings of relaxation and drowsiness. Combined with the general physical relaxation that follows sexual activity and the stress-reducing effects of endorphins and oxytocin, this creates ideal conditions for restful sleep. Many men find that sexual activity before bed helps them fall asleep more quickly and enjoy deeper, more restorative sleep throughout the night. The mood-enhancing effects of regular sexual activity extend well beyond temporary post-orgasm pleasure. Research consistently demonstrates that men who maintain regular sexual activity report lower rates of depression and anxiety compared to sexually inactive peers, even when controlling for other health and lifestyle factors. This protective effect likely operates through multiple pathways. The regular neurochemical rewards of sexual activity help maintain healthy brain chemistry, particularly dopamine and serotonin levels that are crucial for mood regulation. the sense of vitality and capability that comes from maintaining sexual function supports overall psychological well-being and life satisfaction. Self-esteem and masculine identity face unique challenges as men age. Society often equates masculinity with youth, physical strength, sexual prowess, and career success. As these markers naturally shift with aging, many men struggle with feelings of diminished value or lost identity. Maintaining sexual function and activity provides a powerful counterforce to these negative narratives. When a man in his 50s, 60s, or 70s continues to experience satisfying sexual function, it affirms his continued vitality, attractiveness, and masculine identity. This isn't about clinging to youth, but rather about recognizing that sexuality and vitality don't expire at some arbitrary age. Body image concerns affect men more than commonly acknowledged, particularly as aging brings changes in muscle mass, weight distribution, energy levels, and physical appearance. Regular sexual activity, including masturbation, helps men maintain a more positive relationship with their bodies. Sexual pleasure reminds us that our bodies remain sources of joy and satisfaction, not merely vehicles gradually breaking down. This positive embodiment contributes to better self-care, healthier lifestyle choices, and greater overall life satisfaction. For men in relationships, regular sexual activity strengthens emotional bonds, maintains intimacy, and provides a unique form of communication and connection that words alone cannot achieve. Sexual intimacy creates vulnerability, trust, and mutual pleasure that deepen partnership bonds. For single men, masturbation provides a healthy outlet for sexual expression, allowing them to maintain sexual wellness and satisfaction independent of relationship status. This autonomy over one's sexual health and pleasure represents an important aspect of personal agency and self-care. Cognitive function and brain health also appear to benefit from regular sexual activity. Emerging research suggests that sexual activity may help maintain cognitive sharpness and potentially reduce dementia risk in aging populations. The mechanisms likely include improved cardiovascular health, which supports brain blood flow, along with the neurochemical stimulation that sexual activity provides. The brain regions activated during sexual arousal and orgasm overlap significantly with areas involved in memory, emotion regulation, and executive function, suggesting that regular sexual activity may help keep these neural networks robust and well-functioning. While the overwhelming evidence supports the health benefits of regular sexual activity and ejaculation for men over 50, maintaining balance and recognizing potential concerns represents an essential aspect of holistic sexual wellness. Understanding when frequency might become problematic, recognizing warning signs of unhealthy patterns, and knowing how to maintain a balanced approach ensures that sexual activity remains a positive contributor to overall health rather than becoming a source of physical discomfort or psychological distress. The goal isn't to create anxiety around normal sexual behavior, but rather to provide clear guidelines for healthy sexual expression while identifying the relatively rare situations where intervention or adjustment might be beneficial. Compulsive sexual behavior represents one of the most significant concerns regarding excessive masturbation frequency. While regular masturbation is healthy and normal, it crosses into problematic territory when it begins to interfere with daily responsibilities, work performance, social relationships, or overall quality of life. Compulsive behavior differs fundamentally from simply having a high sex drive or enjoying frequent sexual activity. The key distinguishing factor involves loss of control and negative consequences. When a man finds himself masturbating despite wanting to stop, when sexual thoughts become intrusive and interfere with concentration on important tasks, or when opportunities for masturbation take priority over professional obligations or social commitments, these patterns suggest that the behavior has moved beyond healthy expression into compulsive territory that may benefit from professional support. The psychological distress associated with sexual behavior can manifest in various ways, often rooted in cultural, religious, or personal beliefs about sexuality. Some men experience significant shame, guilt, or anxiety surrounding masturbation, even when engaging in it at perfectly normal and healthy frequencies. These feelings don't necessarily indicate that the behavior itself is problematic, but rather that the individual's relationship with their sexuality needs attention and healing. Shame and guilt around normal sexual expression can create a destructive cycle where the emotional distress actually increases compulsive tendencies, as men may turn to sexual activity as a way to temporarily escape negative feelings, only to experience intensified shame afterward. This pattern can become deeply entrenched and may benefit from counseling or therapy to help develop a healthier, more accepting relationship with one's sexuality. Physical discomfort provides clear signals that frequency or technique may need adjustment. While the male body is remarkably resilient, excessive masturbation can occasionally lead to physical issues including skin irritation, soreness, temporary desensitization, or in rare cases, minor tissue injury. Pain should never be a regular part of sexual activity. If masturbation consistently causes discomfort during the act or afterward, this indicates that something needs to change. The issue might be as simple as using inadequate lubrication, employing too firm a grip, or engaging in excessively lengthy sessions. However, persistent pain, particularly pain that worsens over time or accompanies urination or ejaculation, warrants medical evaluation to rule out underlying conditions such as prostatitis, urinary tract infection, or other urological concerns. Prostatitis, or inflammation of the prostate gland, presents a specific situation where ejaculation frequency recommendations may differ from general guidelines. Some men with chronic prostatitis find that frequent ejaculation aggravates their symptoms, causing increased pelvic pain, urinary discomfort, or general pelvic tension. However, other men with prostatitis actually experience relief from regular ejaculation, finding that it helps drain the prostate and reduce pressure and inflammation. This variability means that men dealing with prostatitis need to pay careful attention to their individual responses and work closely with their urologist to determine what frequency and pattern of sexual activity best supports their healing and comfort. Men who have undergone prostate surgery, whether for cancer treatment, benign prostatic hyperplasia, or other conditions, face unique considerations regarding sexual activity timing and frequency. Recovery protocols vary depending on the specific procedure, and following medical guidance becomes absolutely critical during the healing period. Some procedures require several weeks of abstinence from ejaculation to allow proper healing, while others may encourage earlier resumption of sexual activity. Attempting to return to sexual activity too quickly can potentially compromise healing or create complications, making it essential to have clear communication with surgical teams about appropriate timelines and any warning signs to watch for during recovery. Relationship dynamics introduce another dimension where masturbation frequency might require thoughtful consideration. Masturbation is a normal and healthy part of sexuality for both single and partnered men. However, when masturbation consistently replaces or reduces partner intimacy in ways that cause distress to either partner, it signals a need for honest conversation and possibly relationship counseling. Sometimes masturbation becomes a way to avoid intimacy, communication difficulties, or sexual dysfunction concerns within a relationship. In these cases, the masturbation itself isn't the core problem, but rather a symptom of deeper relationship issues that need addressing. Pornography use often accompanies masturbation in contemporary culture. And while pornography itself isn't inherently harmful, problematic patterns can develop. Excessive pornography consumption can sometimes lead to unrealistic expectations about sexual performance, partner appearance, or sexual scenarios. Some men find that heavy pornography use affects their ability to become aroused by or satisfied with real-world sexual encounters. Additionally, pornography that depicts increasingly extreme or novel content can potentially alter arousal patterns over time, a phenomenon sometimes called escalation. Men who notice that they require increasingly specific or extreme pornographic content to achieve arousal, or who find real-world sexual encounters less satisfying than pornographic fantasy, may benefit from reducing pornography consumption and focusing more on embodied, present-moment sexual experiences. The concept of balance and moderation ultimately comes down to self-awareness and honest self-assessment. Healthy masturbation frequency varies tremendously between individuals based on age, overall health, relationship status, stress levels, and natural sex drive variations. Rather than adhering to any specific numerical guideline, men benefit most from paying attention to how their sexual behavior affects other aspects of life. Questions to consider include whether sexual activity enhances overall well-being, whether it fits comfortably within daily life without creating scheduling conflicts or stress, whether it contributes to rather than detracts from relationship satisfaction, and whether it feels like a choice rather than a compulsion. When sexual activity checks these boxes, frequency becomes far less important than the overall quality and integration of sexuality within a balanced, healthy life. Understanding sexual health after 50 requires looking beyond any single behavior or intervention and embracing a truly holistic approach that recognizes the interconnected nature of physical wellness, mental health, lifestyle choices, and medical care. While regular ejaculation offers significant benefits for prostate and overall health, it represents just one component of a comprehensive strategy for maintaining vitality, function, and satisfaction throughout the aging process. The most successful approach to senior sexual health integrates multiple dimensions of wellness, recognizing that what we eat, how we move, how we manage stress, and how we engage with healthcare all profoundly influence sexual function and overall quality of life. Nutrition stands as a foundational pillar of prostate and sexual health, yet many men underestimate the profound impact that dietary choices exert on sexual function, prostate wellness, and overall vitality. The foods we consume literally become the building blocks of our cells, influence our hormone production, affect our cardiovascular health, and either promote or prevent inflammation throughout the body. For prostate health specifically, certain nutrients and food compounds have demonstrated particularly promising benefits in research studies. Lycopene, a powerful antioxidant that gives tomatoes, watermelon, pink grapefruit, and papaya their red color, has been extensively studied for its potential protective effects against prostate cancer. This compound appears to accumulate preferentially in prostate tissue, where it may help neutralize free radicals and reduce oxidative damage that can lead to cellular mutations and cancer development. Cruciferous vegetables including broccoli, cauliflower, Brussels sprouts, kale, and cabbage contain unique sulfur-containing compounds called glucosinolates that break down into biologically active substances with demonstrated anti-cancer properties. Research suggests these compounds may be particularly beneficial for prostate health, potentially interfering with cancer cell growth and promoting the elimination of carcinogenic substances from the body. The protective effects appear strongest when these vegetables are consumed regularly over long periods, suggesting that consistent dietary patterns matter more than occasional healthy meals. Preparing these vegetables properly also matters, as excessive cooking can destroy beneficial compounds, making light steaming or raw consumption preferable to prolonged boiling. Healthy fats, particularly omega-3 fatty acids, found abundantly in fatty fish like salmon, mackerel, sardines, and herring, as well as in walnuts, flax seeds, and chia seeds, support sexual health through multiple mechanisms. These essential fats reduce inflammation throughout the body, support healthy hormone production, including testosterone synthesis, improve cardiovascular function and blood flow, and support the health of cell membranes throughout the body, including in reproductive tissues. The Mediterranean diet pattern, which emphasizes these healthy fats, along with vegetables, fruits, whole grains, and moderate amounts of fish and poultry, while limiting red meat and processed foods, has been associated with better sexual function and lower prostate cancer risk in numerous studies. Conversely, certain dietary patterns appear to increase prostate cancer risk and impair sexual function. High consumption of red meat, particularly processed meats, and those cooked at very high temperatures, has been linked in some studies to increased prostate cancer risk. Similarly, high-fat dairy products consumed in large quantities may negatively impact prostate health, though the evidence remains somewhat mixed and continues to evolve. Trans fats and highly processed foods contribute to inflammation, cardiovascular disease, and metabolic dysfunction, all of which undermine sexual health and erectile function. Sugar and refined carbohydrates can lead to blood sugar instability, weight gain, and insulin resistance, creating conditions that impair sexual function and increase disease risk. Hydration deserves special attention for prostate and urinary health. While some men with urinary frequency concerns attempt to limit fluid intake, adequate hydration actually supports better urinary and prostate function. Proper hydration helps flush the urinary tract, reduces the concentration of potentially irritating substances in urine, and supports overall metabolic health. The key involves spacing fluid intake throughout the day rather than consuming large amounts at once, and potentially reducing intake in the evening hours to minimize nighttime bathroom trips. Physical activity and exercise represent another crucial pillar of holistic sexual health, with benefits extending across virtually every system relevant to sexual function. Cardiovascular exercise, including brisk walking, jogging, cycling, or swimming, improves heart health and strengthens the circulatory system that erectile function depends upon. Regular aerobic activity reduces inflammation, helps maintain healthy body weight, improves insulin sensitivity, and supports mental health. Research consistently demonstrates that men who engage in regular cardiovascular exercise maintain better erectile function as they age compared to sedentary peers. The exercise doesn't need to be extreme or punishing. Even moderate intensity activity for 30 minutes most days of the week provides substantial benefits.